Now to discuss how the cost will change for you is Arielle Kane, Director of Medicaid Initiatives for Families USA, a nonpartisan organization that advocates for high-quality, affordable health care for everyone. Arielle, thank you so much for your time. So changes in cost really depend on if you have insurance or not and the type of coverage you have. So let's start with people who are uninsured. What kind of access to free tests or vaccines will they have?
So that's a group that's definitely going to be hurt the most by the end of the public health emergency. If you don't have insurance, you will be paying out of pocket for vaccines, for treatments, and for tests. Right now, the federal government has procured millions of both tests and treatments. And so until that supply is out, it will still be provided for free. So that's Paxlovid, that is free at-home tests through the Postal Service, etc., and vaccines, of course. But those supplies are dwindling. And once they're out, you'll be left on your own to purchase those. We don't know the price of everything. Vaccines will likely run around $130 a dose. Paxlovid, the government purchased it for $530 a dose, but we don't know yet what it will be priced at in the commercial market. So that could be really expensive if you don't have insurance coverage.
So what about for people with Medicaid and Medicare? It sounds like there's some good news when it comes to free services for those folks. What can they expect when it comes to changing COVID tests and treatments?
Yes, you are more protected if you have Medicare or Medicaid. So people with Medicare will still have access to COVID tests if they're ordered by a provider. So no longer free at-home tests, but if you're getting a PCR test at a lab, that'll still be covered. They'll still have access to Paxlovid either through the amount that the government purchased or once that expires. Medicare will still continue to cover it. Medicaid, again, will continue to cover treatments as well. The trick is, though, that as your last guest mentioned, millions of people may no longer be eligible for Medicaid, which means they could be losing their coverage and either be left uninsured or moving to private coverage where the rules will be different.
So a report by the Urban Institute in December estimated that 18 million people could lose Medicaid coverage when these emergency declarations end. Why could that possibly happen?
So it's actually been, delinked from the public health emergency and the spending bill that passed at the end of the year. So now, beginning April 1, regardless of the public health emergency, people will need to prove that they are still eligible for Medicaid. And many people will still be eligible, but maybe don't go through the bureaucratic hurdles of proving it, and then they could lose their coverage. Other people, their income will have changed, maybe their pregnancy status changed, or some other reason why they were eligible for the program. And those people need to make sure that they know if they're getting kicked off of Medicaid and then be prepared to find a new source of coverage, whether that be from their employer or through the ACA's marketplaces. So to not fall into that group that we mentioned, that where none of these treatments are going to be covered and being uninsured, you need to reach out to your state, make sure that they have your latest contact information, and then enroll in another source of coverage if you are no longer eligible for Medicaid. I think that that's the biggest challenge, and that's where we're most worried about people losing access to COVID treatments and COVID vaccines and COVID tests.
And you mentioned Pfizer and Moderna pricing their vaccines at around $110 to $130, and that's what it would cost people without insurance. If you do have private insurance, of course, depending on what company and what provider you use, it could change. But do you expect there to be out-of-pocket costs, and would it be limited to one booster a year? How do we expect this to be priced out for those who do have insurance?
Yeah, so for those who are enrolled in private coverage, the rules are that, most private plans have to cover certain preventative services. And so as long as the CDC Advisory Committee is saying that the COVID vaccine is a preventative service, it will continue to be covered with minimal to no cost sharing. The key is, right now we saw them recommend moving to an annual schedule, but, that could change in the future. We could, the vaccines, the virus could evolve, like things could change. But right now, that should be covered if you have private insurance. The big unknown is COVID treatments. So Paxlovid is the drug the antiviral drug that's been used to treat COVID. Something like 6 million people have received a course of treatment. That drug will not be required to be covered by private insurers, and we don't know yet what it's going to be priced at. So we saw that the vaccines were purchased by the federal government for $20 a dose, but going into the private market, they're going to be priced at around, $130 a dose. So you could imagine if the federal government procured Paxlovid at $530 a dose, the price could be a lot more than that once it's in the private market. And people could have high copays, it couldn't be covered, etc. Again, for now, the government has procured about 20 million doses, and I think just around 6 to 7 million have been used. So we still have a lot more doses that will be available for free if you're prescribed it. But once that runs out, it's the unknown. It's Wild West. We don't know what's coming.
Yeah, down the road, the cost could really add up for somebody that doesn't have insurance.
All right, Arielle Kane,
Yes, exactly.
Director of Medicaid Initiatives for Families USA. Thank you so much for joining us. Really appreciate it. This information it's complicated, but really important for people to know. So thank you.